Hey guys, हजुरहरुलाई मेरो भिडियोमा धेरै धेरै स्वागत छ। आजको भिडियो चाहिँ यो भिडियो चाहिँ एकदमै इन्फर्मेशनल काइन्ड अफ भिडियो हुनेछ, जसमा चाहिँ हामीहरुले डिस्कस गर्ने छौं कि what are the most probable nursing interview question, like job interview question भनेर. And bear in mind guys, these all answers or questions are based on my experiences, and please take this information like reasonably. These all answers will be like example answers. It doesn't mean that you need to answer the same question like exact same. You can make up your own answers and stuff like that, okay? And talking about myself, I'm a newly qualified nurse. I was a student here in UK and I finished my education in this March 2024, and I'm working as a nurse since April, so yeah, April 22nd to be exact. So hey guys, welcome to this channel or video. I don't know where you guys are watching from, but so the intent of this channel is to, you know, like make more informational contents or videos so that it might be helpful for so many like newcomers and students and professionals as well. If you got any other like questions, then please do comment. It's gonna be so helpful for others. So let's get started without further delay. So let's start with first question that's gonna be introduce yourself as usual, or tell me about yourself. So in this question, the interviewer wanna ask like, what is your background related to the job, like the position you're applying for. Bear in mind guys, in each or every question you need to link your job, like what you're applying for. Let's say if you're applying for nursing, that's what we are doing now. So if you're applying for a nursing job, then what is your background related to that work or to that position, and how do you know, like qualify yourself in that position? So okay, so I will say with the general introduction, hi, my name is Anna. You can also call me Anna. And talking about my educational background, I've just finished my BSc nursing adult degree this March, and here I'm pretending like I haven't got a job and I'm looking for a job after finishing my degree. Okay, so you can make your answer accordingly as well. So here I'll say, hi, my name is Bhavna Gimire, and you can also call me Anna. And talking about my qualification, I've just completed my BSc Nursing Adult degree this March 2024. And talking about my recent placement, it was in acute settings. Please guys, do not disclose your ward. Some people might find it disclose anything. You can say acute or community or nursing home, but do not disclose any names or wards. So talking about my recent placement experiences, I had my placement in, you know, like one of the busiest in the acute care, and I get to work with so many professionals. If I have to name, with doctors, so many senior nurses, so many nurse specialists like alcohol liaison nurses, respiratory nurses, and tissue viability nurses. And I also done some spoke days with them, and even though it was a bit busy, but I got an opportunity to do so many skills like venipuncture, catheterization, and wound dressings, even though it was not many, and subcat injection, insulins, and all of that. And also got an opportunity to observe skills such as blood transfusions, IV, a chance to make some of the IV. I remember like Tajusin, which you mix in, you know, like 20 mils of water for injection, and then where that goes with 100 mils of normal saline or glucose depending on the patient itself. So I really enjoyed my placement. Yeah, I can say like I've got a good experiences in that ward, and I think I've learned a lot in that ward. Do not express your emotions, but and if Hazur working as a healthcare assistant since that period of times for 2 years, 2 months, blah blah blah, and you can say like you were preparing for, you know, the nursing pin, you were doing OSCE exams, you were doing PTE, everything you can mention. This is just a simple like sample answer which I have said. So do not say like, you can also mention like on my free days I also like traveling and I like to visit many places, but it's not necessary. Like they are not asking about your personal life, they're asking about your professional lives and how prepared you are for this job. So yeah, bear in mind. and the interviewer will say like, oh, hi Anna, okay, there are like series of questions which I'm gonna ask you, and you can answer them like on your own time or blah blah blah. So I've got a notebook with me, so I'm just gonna say like what are the questions they ask me. Okay, so some of them will be like, can you name the 6 C's of nursing and how you're gonna use your 6 C's of nursing while caring for a patient? This is the most important question, okay? So this is something you need to know as well, like 6 C's of nursing. So this is my sample answer, okay? 6 C's of nursing are care, compassion, competence, commitment, courage, and communication. 6 C's of nursing highlights the importance of effective communication in order to deliver a high standard of quality of compassionate care. I believe one should be courageous and competent to deliver safe care to the patient. I will use my effective communication skills in order to deliver compassionate care to my patients. That's something I said or I make, okay? So, and the other question which gonna be will be like, why did you choose this place, like whatever hospital or care home or that, you know, like what you're applying for. You can say like the skills that you, for me it was like, I know this ward was so busy, but as a newly qualified nurse I would like to, you know, like get a basic or build my base in somewhere where I can practice all my skills, such as blood, like venipuncture, catheterization, IVs, blood transfusion, NG feeding, and focus on the skills they do and the values for them. And if you're going to say about the hospital itself, you need to know like what are the values. Like some hospital might be putting patient first, like I know the importance of like patient-centered care, and that's what made me feel like I belong here. That is like by putting patient first we can make a difference in their life. By, you know, like by seeing patient as an individual we can make a difference in their life, and transfer from your, you know, like previous job to this job, or your previous role to this role. And that one you can say like, I'll say like according to my university. Okay, so in university we used to, you know, like we were given like so many assignments in this sort of period of time. So by doing that I learned like management skills as well, so that is something I can, and organization skills as well. So I know like if you're not organized then you can't manage your time as well. So I believe organization and then time management skills goes hand in hand. So that's something I can transfer from my previous role to this role, or my previous job to this job. Or what was the most challenging part of your recent role? In that one you can say like, I remember like one of my dementia patient, or one of my patient wanted to go home, but the home was not safe, or because of their mobility, or because of the mental condition, blah blah blah. I did explain that to them, but they were not listening to me. But they were like continuously saying like they want to go home, and they were sometimes aggressive to me. I know that's not their fault, and they, you know, like they are not, you know, like mentally they are under doll, so they can't take their own decision or something like that. And that was the best option for them. I do feel like home is the safest place, but for them it might not be, because of their like certain condition, diseases, or safeguarding concerns, or so many concerns. I did explain them, but they're not listening at all. I know I feel bad for them, but in my hand I can't do anything. So I feel a bit, you know, like challenging that time, because I want to do something for them, but that is not something in my hand. So yeah. So guys, these are the scenario-based questions now. Okay, so what would you do when the patient complains of the chest pain? So that's how they're understanding your escalation process gonna be. How do you work with the team? So there one, basically the chest pain is a sign of angina. I would check if the patient has got any history of angina, and if GTN, that means glycerol trinitrate, is been prescribed for the patient, I would administer or let patient take GTN. If not, I would escalate to the senior nurse and also to the doctor and ask for some pain relief. If the GTN is not right, then you would ask doctor to prescribe some pain relief, or doctor would see the patient and they will prescribe something accordingly. And also you want to make sure that patient hasn't got any, patient is not sneezing, so you can take your patient's observation and ask for help and administer oxygen if necessary. But you know what, oxygen also needs prescribing as well, so make sure it's prescribed. So better to do, like escalate to the doctor, and doctor would recommend you to, if that is something emergency, then you can also give like oxygen therapy without prescription. If you notice that the patient is given 20 units of insulin instead of 2, what would you do in that situation? So it's a human error question, so you need to answer this reasonably. Okay, so first thing you want to do is, I will stop the infusion as soon as possible. I'll check the obs and start oxygen therapy under prescription if necessary. And I will also check the blood sugar level and follow the plan accordingly, like for high anemia. I'll give patients some fizzy drink and some high carbon toast or jelly babies to increase the sugar level. I will document everything, as this is a medication error or human error. I will date and make patient next of kin aware of the scenario. So if a patient appears all bruised, like like physically abused or something like that, in that scenario, what would you do? So first thing, you need to write in the notes that what are your concerns are like, and you also want to like escalate that one to your senior nurse in charge, and if necessary you want to involve the safeguarding team. So that are the things you would do as well. So yeah, if the patient is allergic with penicillin, but if you found like patient is given penicillin just now or blah 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 something like this के allergic reaction को बारेमा क्वेशन सोध्न सक्छ, तर यसको बारेमा चाहिँ हजुरले के भन्दाखेरि I'll stop the infusion or whatever is given as soon as possible, and I'll inform the doctor, senior nurses and ward manager if necessary, and I'll observe for the sign of anaphylaxis. Anaphylaxis भनेको चाहिँ severe हुन्छ नि allergic reaction or reaction to some of the medication or food, like no allergy or like त्यो हो, and you will observe the sign for, like you would do the ABCD assessment, like A मा चाहिँ हजुरले if the patient got hoarseness or stertor in the voice, and B मा चाहिँ respiratory rate, high respiratory rate or wheezing, or any sign of sinuses भनेको bluish skin हुन्छ नि, and also in circulation like low blood pressure, अनि यस्तो साइनहरु चाहिँ हजुरले, अनि फेरि physical observation like skinमा rashes आउने, and this is swelling of lips and swelling of this area, what you called like throats, and the patient looks like so pale and flushed, then already you have informed the doctor probably, and you need to follow like Resuscitation Council of UK को 2021 को anaphylactic algorithm, Sonny, you would follow that, and they will ask you like what is the first thing you would suggest or you think that they would give if someone got anaphylactic reaction. Is adrenaline, I am adrenaline, त्यो चाहिँ हजुरले भन्न सक्नुहुन्छ। अनि फेरि यदि कुनै पनि कारणले केही भएन भने चाहिँ they would also suggest some antihistamine, which is like chlorpramide, त्यो पनि दिन सक्छन्, उसको लागि एलर्जीको लागि chlorpramide पनि दिन्छन्, and oxygen, like high flow oxygen and fluids if necessary. हजुरलाई चाहिँ यो गर्नुपर्छ भन्ने चाहिँ थाहा त्यो पर्दैन, बट हजुरलाई के लाग्छ के दिन्छ होला भनेर सोध्यो भने चाहिँ हजुरले चाहिँ फर्स्ट दिन चाहिँ के अरे I am adrenaline bio if the patient is not like getting well or is showing any sign of like healing or something like that, then you will also give like adrenaline after 5 minutes, the same dose. And basically हजुरलाई चाहिँ मैले उस दिन्छु हैन, त्यो एउटा चाहिँ मैले भेटाएको छु, so Resuscitation Council UK को 2021 को anaphylaxis को बारेमा, so you can read that one. And अरु series of question मलाई युनिभर्सिटीले दिएको थियो, त्यो पनि मैले अपलोड गरिदिन्छु, so helpful, so probably it gonna be helpful for you. And guys, हजुरहरुलाई कुनै हुन्छ नि आउँछ भने चाहिँ please do not forget to comment it down. अब मेरोमा यस्तो सोधेको थियो, हजुरकोमा अर्को सोध्न सक्छ, and I've got a series of questions which I will upload as well. And okay guys, stay tuned for more like nursing contents. मैले चाहिँ अब अर्को चाहिँ अब सेप्टेम्बर इन्टेक आउन लाग्यो, त्यति बेला चाहिँ like nursing course को चाहिँ interview question लिएर आउँदैछु, so stay tuned for that. And thank you so much for watching this video, and if you find this video, please subscribe to my YouTube channel, subscribe to my TikTok account, and you can also follow me on Instagram. And until then, thank you so much for watching. Until then, bye.